Me, the most important thing about being a dental assistant would be advocating for the patients and actually being there to listen to them. A lot of them come in having a fear, right, and not really knowing what they're going to get out of it. So really listening to the patient, advocating for the patient, and just listening what they're here for. My name's Obed, and I've been an expanded function dental assistant for just about 10 years now in the state of Oregon, Portland.
I really think that having a dental assistant is so very important, and for me, in my practice, I like a set the bar, high standards, and I like a dental assistant that is well trained and educated. So even if I happen to leave the room, I know that my patient is being taken care of well by the dental assistant that I have sitting next to me. I'm Dr. Jill Price, and I've been practicing in Portland for 31 years in a private general practice, my solo practice. I think that the main thing is that dental assisting, it's so much more than what I think people think it is, right? Like Obed alluded to, he's an advocate for the patient. Of course, we both are. But to have another voice in the room to maybe be able to tell me, what they were discussing, these are their concerns, I think that that's a great thing to have a good dental assistant. Plus, of course, having a dental assistant is so very important because I want somebody who can ease my production, make the procedure go easy and safer. I mean, having a well-trained dental assistant really increases the safety of the patient and for even the two of us working together.
What I like about being a dental assistant is that every case is like a project. I see it like a little bit of an art project. Everyone's a little bit different, so everybody that walks in the door, you don't know what's going to happen. So I like treating it a little bit like a science project. There is really no average day as a dental assistant. Quite frankly, we all work in the dental field. We know right away that things can change. Things change by the minute, by the hour, even while you're doing the procedure sometimes. You think you're doing a filling and it turns into a root canal. So you really have to be on your toes, and it keeps you on your toes and it keeps it fun too. So every day is a different day, and that's what I really love about dentistry.
And if they weren't here, it would just kind of fall apart. So I think that having that person be kind of the conduit for the whole office, somebody that is really highly trained can take this job really to the nth degree because, like I said, it's not just about just sitting chairside. It's really coordinating what's going on in the office. They really need to know what is going on in all areas of the dental practice. So they need to know what the front office is doing and how that's going to affect the back office. Even what the hygienists are doing, the timing and where people are at all times. If you don't have a dental assistant on your day, it's a big scramble. So I think it's when you don't have your dental assistant, you appreciate how much you need that person. So if I don't have my dental assistant, and I've had to work solo before, I probably can produce at about 25% of capacity. My ergonomics of the chair go to pieces because I am reaching and trying to grab and do things. If I don't have some of the supplies on hand, I myself am jumping up from the chair and running to find them. And dental assistants always hide stuff, so then you can't find it. They do that on purpose for job security. So doctors just really struggle if their dental assistant isn't there. But I think that also the patient is what suffers, right? The patient truly suffers when the dental assistant isn't there. They watch me leaning over them and trying to do things by myself, and I think that the patient really suffers.
What's really great about dentistry is not only do you have general practice, which is what we do, but there's a lot of specialty. That's one of the employment opportunities. You can do surgery, periodontist, anything, right? But also, the more experience you gain, the more things you can do, such as teaching. You can be an instructor like I was for a while. And then being part of organizations for dental assisting, I mean, it's endless, the possibilities that you can do.